Module 2, Chapter 3, Maintaining Health Records and Screenings. Maintaining accurate student health records is a key responsibility for early childhood educators. These records provide a comprehensive view of a child's health history, including immunizations, allergies, chronic conditions, and any previous illnesses. This information allows educators to make informed decisions about how to care for each child and respond appropriately in the event of a health concern. For example, if a child has a known allergy to a certain food or medication, having that information readily available in their health record ensures that educators can take the necessary precautions to prevent exposure. Additionally, these records help educators and caregivers identify patterns or trends that may indicate a need for further health evaluation. Accurate record keeping is also important for ensuring compliance with state and local health regulations. Many regions have strict requirements regarding the documentation of children's immunizations and health screenings, and failure to meet these requirements can result in penalties for the child care facility. By maintaining thorough and up-to-date records, educators not only protect the health of the children in their care, but also ensure that their program remains in good standing with regulatory authorities. Health screenings are another critical component of maintaining children's well-being in early childhood education settings. These screenings, which can include vision and hearing tests, dental checkups, and developmental assessments, help identify potential health issues early on. When problems are detected at an early stage, educators and caregivers can work with families and health professionals to address them before they become more serious. For example, if a vision screening reveals that a child is struggling to see clearly, the child can be referred to an eye care specialist for further evaluation and corrective measures. Early detection of health issues like this can significantly improve a child's ability to learn and thrive in the classroom environment. In addition to vision and hearing screenings, daily health observations are a key aspect of monitoring children's well-being. Conducting these observations allows educators to identify any immediate health concerns, such as signs of illness or injury. For example, if a child arrives at school with a persistent cough or appears unusually lethargic, the teacher can take note of these symptoms and notify the child's parents. Conducting daily health assessments is important because there is a direct relationship between a child's health and their ability to learn. When children are in good health, they are better able to focus, participate, and engage in classroom activities. Conversely, when a child is not feeling well, it can negatively affect their ability to learn and interact with their peers. By conducting daily health assessments, educators can ensure that children are in good health and ready to learn. When conducting health observations, it is essential that the information gathered is recorded carefully and precisely. This is important for several reasons. First, accurate records help identify patterns of illness, such as recurring symptoms that may indicate an underlying health issue. Second, the information can be used by health professionals for diagnostic purposes, helping them make more informed decisions about a child's care. Finally, recording health observations allows educators to monitor changes in a child's appearance or behavior that may require further evaluation. For example, if a child who is normally energetic and engaged suddenly becomes withdrawn or appears fatigued, this could signal a health concern that needs to be addressed. Partnerships with families and communities are essential for effective health monitoring in early childhood education. Educators must work closely with parents and caregivers to ensure that they are informed about their child's health status and any concerns that arise. Communication between educators and families is key to ensuring that children receive the necessary care and support both at school and at home. For example, if a health screening identifies a potential issue, educators should collaborate with the child's family to determine the next steps, such as scheduling a follow-up appointment with a healthcare provider or implementing specific accommodations in the classroom to support the child's needs. In addition to working with families, educators should also partner with community health resources to provide comprehensive care for children. This could include collaborating with local health departments, pediatricians, dentists, and other healthcare professionals to ensure that children have access to the services they need. For example, some early childhood programs may arrange for mobile health clinics to visit the school, providing screenings and immunizations on site. These partnerships not only make it easier for families to access healthcare services, but also promote a holistic approach to children's health and well-being. The importance of maintaining accurate health records and conducting regular screenings cannot be overstated. These practices are essential for ensuring the safety and well-being of children in early childhood education settings. By carefully tracking each child's health and identifying potential concerns early on, educators can create a supportive and healthy environment that allows all children to thrive. It is important to keep in mind as an educator, if an administrator contacts you to request the health records of a former student, it is important to remember that such records are confidential and protected under laws like the Family Educational Rights and Privacy Act, FERPA, and, in some cases, the Health Insurance Portability and Accountability Act, HIPAA. You must first obtain written permission from the child's family before releasing any information. Without the family's explicit consent, sharing health records could violate privacy regulations, jeopardize the student's confidentiality, and lead to legal consequences. Therefore, ensuring proper authorization before disclosing any sensitive information is crucial to maintaining professional and legal standards. Chapter 4. Caring for chronically ill children. Caring for chronically ill children requires special attention to their unique health needs, as well as ensuring they have the same opportunities to engage in educational activities as their peers. Health policies are vital for managing chronic illnesses in early childhood education settings. These policies outline the procedures for administering medication, monitoring symptoms, and responding to health emergencies. For example, children with asthma may require regular monitoring of their breathing, the use of inhalers, and swift action if they experience an asthma attack. One of the key strategies for managing asthma in children involves knowing how to respond in case of an asthma attack. If a child is experiencing an asthma attack, the educator should administer any prescribed medications, such as an inhaler, as directed by the child's healthcare plan. If the child's symptoms worsen and they begin to experience respiratory distress, the educator should immediately call for emergency medical assistance. During an asthma attack, giving the child small sips of room temperature water may help them stay calm and hydrated, but it is critical not to delay necessary medical interventions. A team approach is essential when caring for children with chronic health conditions. This approach includes educators, families, healthcare providers, and other professionals, such as health consultants, who specialize in pediatric care. These teams work together to ensure that children with chronic illnesses receive appropriate care and that their educational experience is not compromised. The Individuals with Disabilities Education Act, IDEA, outlines the rights of children with special needs, including chronic health conditions, to receive the services and accommodations they need in school settings. Under IDEA, children may qualify for services that provide additional support, such as a one-on-one aid, specialized healthcare plans, or access to specialized medical equipment. The role of the health consultant in early childhood education is invaluable when it comes to managing the health needs of children with chronic illnesses. A health consultant is often a medical professional, such as a nurse or pediatrician, who works with the early childhood education program to ensure that children's health needs are met. The health consultant provides guidance on how to implement health care plans, offers training for educators on how to care for children with specific health conditions, and helps create policies to manage chronic illnesses in the classroom. Additionally, health consultants can act as a liaison between the child's family and the school, ensuring that communication is clear and that the child's healthcare plan is consistently followed. Having a medical home for each child is another important concept in managing chronic illnesses in early childhood settings. A medical home is a partnership between the family, the child's primary care provider, and any specialists who manage the child's health care. This partnership ensures that the child receives coordinated care and that all aspects of the child's health are addressed. The medical home model emphasizes the importance of ongoing communication between healthcare providers and the family, as well as the child's early childhood educators. By maintaining a medical home, children with chronic health conditions receive comprehensive care that is tailored to their specific needs, helping to prevent complications and promoting overall wellness. When caring for children with chronic illnesses, educators must also be mindful of the emotional and psychological impact these conditions can have on the child. Chronic illnesses can be isolating for children, especially if they are frequently absent from school due to medical appointments or hospital stays. It is important for educators to foster a supportive and inclusive classroom environment where all children feel accepted and valued. Teachers can promote this by encouraging empathy among classmates and helping children with chronic illnesses stay engaged with classroom activities, even when they are unable to attend in person. For instance, if a child is absent due to illness, the teacher might arrange for the child to participate in lessons virtually or provide take-home assignments so that they do not fall behind. Educators must also be prepared to teach children about managing their own health. This can be done through curriculum activities that help children understand their illness and how to care for themselves. For example, a child with diabetes may need to learn how to monitor their blood sugar levels or follow a special diet. Educators can support this process by working with health professionals and families to develop age-appropriate lessons that empower children to take an active role in managing their health. Teaching children these self-care skills not only helps them stay healthy, but also fosters independence and confidence. Managing this condition typically involves helping the child follow a healthy diet and encouraging physical activity. Weight management is often a crucial part of the treatment plan for children with type 2 diabetes, as maintaining a healthy weight can help regulate blood sugar levels and reduce the risk of complications. Educators can support children with diabetes by ensuring that their dietary needs are met during snack and mealtime and providing opportunities for physical activity throughout the day. The partnership between educators and families is especially important when managing chronic illnesses in early childhood education. Families are the primary source of information about their child's health, and they play a key role in developing and implementing the child's health care plan. Educators must maintain open and regular communication with families to ensure that the child's needs are being met and to address any concerns that may arise. For example, if a child's health condition changes, or if there are updates to their treatment plan, it is essential that educators are informed so that they can adjust the child's care accordingly. Recognizing the symptoms of chronic illnesses can be challenging, as these symptoms may develop slowly over time and be less obvious than those of acute illnesses. For example, symptoms such as fatigue, irritability, or difficulty concentrating may be mistakenly attributed to behavioral issues rather than an underlying health condition. This is why regular health screenings and communication between educators and health professionals are so important in early childhood education. By staying vigilant and monitoring changes in a child's behavior or physical appearance, educators can help identify potential health concerns early and take appropriate action. Finally, engaging diverse families in managing chronic illnesses in early childhood settings is essential for ensuring that children receive culturally competent care. Families from different cultural backgrounds may have varying beliefs about healthcare and treatment, and educators must be respectful and accommodating of these beliefs. For example, some families may prefer alternative treatments or may have dietary restrictions based on cultural or religious practices. Educators should work closely with families to understand their preferences and ensure that the child's healthcare plan aligns with their values while still meeting the child's medical needs.